What's going on, everyone? Happy Thursday. Hopefully everyone is doing well, staying safe, healthy, testing negative for the viruses, and having a great day so far. It is time now for the Thursday edition of the Virus Update for Thursday, July 3rd, 2025. If you're new to my channel, welcome to my channel. You just clicked onto the channel that gives you all the updates on the viruses that can make us sick. Yes, viruses do exist, and yes, people are still getting sick from the big one, COVID. COVID is still a big problem in many places around the world. There are actually active waves ongoing right now. We're at the start of our summer wave here in the United States. That wave is about to be accelerated because we have a big holiday tomorrow, the 4th of July, the birthday of America. So if you're new to my channel and you want to stay informed, subscribe down below. Give this video a thumbs up. Hit that notification bell and share this video with anyone that you know. Alrighty, we do have some news stories and some updates to talk about today, and we do have a few other things that we'll be talking about along the way. Today we're going to start off in New Zealand, Aotearoa, New Zealand. I think I'm saying that correct. Aotearoa, New Zealand. The point is, this is something that's not good. Many children suffering ongoing COVID symptoms. Now, New Zealand did not really have a big wave at the beginning of the pandemic. And to be fair, it took a while for things to start getting going there. And get this, in 2022 to 2023 was the time that they surveyed more than 4,200 children aged from 3 years old up to 20 years old. You know what they found? They found that more than 20% of children and young people in this portion of New Zealand are experiencing significant persistent health symptoms following a COVID-19 infection, according to this new study. That is not a good thing whatsoever. And more than 70% of the participants reported a confirmed COVID-19 case. Yeah, this is not good. There's going to be a post today on my site, datareport.info. You'll be able to view all the things that we're talking about today. All right, over in Queensland, in Australia. Remember, in these areas I'm talking about right now, it is winter over there. So COVID at the moment there, it is actually a problem in all these areas, as is the flu and other things in Australia. And in Queensland, Health has issued an alert over the rising number of hospitalizations. Yeah, during the past week, June 23rd to June 29th, more than 2,800 flu cases have been recorded, the highest number in a single week so far this year. And it sounds like they're talking about nearly 300 Queensland hospital beds per day were currently occupied by people with the flu or COVID-19. That's a lot of hospital capacity being used at this time because of flu and COVID. And remember, here in the United States during our winter last year, COVID was not the main show. Flu, however, was really bad last winter. And some people say, oh, you don't talk about flu. It's always COVID this, COVID that. Well, here we go. We're talking about flu right now. It's the combination of the viruses that was the problem here in the United States last winter. And it seems to be the theme over in Australia right now, or at least in Queensland. And, you know, oftentimes Australia can be a bellwether for what's going to happen here come the fall and winter time. All right, take a look at this. But, hey, before we get to the fall and winter, we got to get through a summer wave here in the United States. All right, Queensland influenza. This is from Dennis the COVID info guy. So far this year, this is as of June 29th, for COVID, they've had 21,297 cases. Remember, that doesn't always include these at-home COVID tests. And you know what? I often refer to at-home COVID tests. I should probably change that narrative a little bit and maybe say it a little differently, because there are now multi-tests out there. You can test for influenza, RSV, I think HMPV. There's a whole bunch of things. I've seen, I think, norovirus as well. It's a whole bunch of different type of tests now. So maybe some flu numbers are not being fully tallied up because of at-home testing as well. Queensland has 29,514 flu cases, and RSV is 13,375. We've got a couple more things from Dennis the COVID info guy. New South Wales respiratory surveillance reports week ending in 28th of June. COVID positivity rate 8.2%. That's down by 0.3%. Number of laboratories reporting 2 out of 4. COVID 3,759 cases. Influenza 6,951 cases. Hey, influenza is still going up big time. 42.4%. And COVID looks to be dropping there. Maybe it has peaked. RSV, maybe that has peaked. 2,692 cases. That's down by 1.4%. And it looks like the NB 0.8.1 is now 76% of cases. Could they double peak there? It's possible, and there's a reason why I just said that. You do not see XFG listed here, and at some point I think XFG would probably enter the picture there. And we can see here that 3 out of the 4 sewage surveillance program areas, wastewater sites, are down. Hunter is still going up at this time. The other 3 are dropping. Alrighty, moving on now, we have something else from Deaths COVID Impact. This is really interesting. Long COVID rates higher in women. Evidence grows. We've heard about this before. It's been a while since we've heard about this. A JAMA study this is a decent sized study, of 12,200 plus participants infected by COVID between 2021 and 2024. Now, I got to pause right there for a second, because oftentimes I talk about these new studies here on the Daily Virus Update, and I think I failed to mention the fact a lot of these studies are from earlier days in the pandemic, like from a few years ago. So a lot of these studies are from older COVID variants. Newer variants could do different things. All right, moving on. Let's restart. A JMA study of 12,200 plus participants between 2021 and 2024 found women were 31% to 44% more likely than men to develop long COVID, even after adjusting for clinical and demographic factors. And you know what? I could say something to that. I follow a lot of people over on X, and I have noticed when it comes to long COVID, I am seeing more female long COVID posts than I am seeing men. I'm seeing a lot of men too, but it seems like the percentage is higher, or at least from the ones I'm following. Now, mind you, I don't follow every single long COVID patient on X. I don't know how many there are that are actually on X. And, well, there's a lot of people that don't even know they have long COVID. But, yeah, there you go. So that is rather interesting. Then there is this. Yeah, big day for studies. Study finds significant uptick in chronic digestive disorders during COVID-19 pandemic. These different things, it can also include GI things. Hey, I can raise my hand and tell you I once went to a GI specialist. It was a one-time ordeal. They said, oh, COVID doesn't cause GI issues. Now, that was because of infection 1, not the infection I had back during the winter. But, yeah, it is digestive issues. Yeah, they are a thing when it comes to COVID. But yet, so many do not want to keep up with these new studies. It's ridiculous. If you want to read this full study, we're not going to do that here. You can go over to my website later on this evening. I will make a post with all these things. All right, thought I would share this with you this way, and we do need to refresh this to get that annoying little thing from X off the screen. I posted this on X earlier. I posted it on the Facebook page and on the Blue Sky page as well. And I said, here is something to watch. COVID wastewater for Harrisburg, Pennsylvania, that's my state, has started to rise on wastewater scan. While this is subject to being corrected, it has occurred right when XFG subvariant has taken over in Pennsylvania. So I thought that was rather interesting. And here's the chart. Take a look at this. Harrisburg's starting to go up. And see, that was right around June 22nd. Then we come over to this. You can see right around June 28th, wastewater detected that XFG took over here in Pennsylvania. So right around, give or take a few days, Harrisburg's starting to increase. Now, that is subject to being corrected over on wastewater scan, just simply because you know how the deal is. Usually at the end of the chart, sometimes it changes a little bit, but I think it probably is legitimate that things are starting to rise. And, well, if XFG's taken over in Pennsylvania, we know it's starting to take over in other places as well. And even if it has not started to rise yet, there is a minimum going to be an increase in transmission post 4th of July, because there's a lot of people that will not be taking precautions prior to whatever it is they are doing for this holiday. All right, moving over to the CDC. A lot of things are not going to update till Monday. This did update, and there are 1,267 cases of measles now reported in the United States, and these cases were reported by 38 jurisdictions, and we're inching closer to that 50 state mark. If You recall yesterday I reported that Wyoming reported their first case this week, and you know what I'm noticing here? I don't see Wyoming listed on here, which tells me that this data is behind already. So that should probably say 39. Now I'm seeing Washington. Yeah, no Wyoming. Did we not just report Wyoming had their first case of measles yesterday? Pretty sure we did. India, active cases, 1,290 at this time. Discharges, 26,799. And let's see, did India report any new deaths today? No, zero. That's fantastic news. All right, moving on now to the UK, which updated today. And I do have some really good news from the UK. Actually, some surprising, really good news from the UK. Weekly COVID cases, 1,125. Down by 15%. 199. Now, remember, at-home testing is a thing there. But take a look here where it says testing positivity rate 7%. Cross that out. Forget about that. Here's the real positivity rate down here. Here's just a little more updated. Take a look at the end. Yeah, it has gone down to 5.73%. Take a look at that chart. That's the biggest drop they have seen in a very long time. You have to go all the way back to the start of May. They had a little mini drop, and then you can see prior to that it was rising. We'll see. UK does tend to sometimes have multiple waves during the summertime. They did last year. I think they peaked at least 2, maybe even 3 times. I don't remember precisely how many times it was, but I also got to show this to you. Deaths, 58, that's down by 2. Again, that could be behind, and this healthcare number, we're just going to forget about that number for now on because, well, if that went up by 81, that means it would be less than 900 last week, and it was 900 something last week. We'll take a look at more stuff from the UK with the other viruses again over the weekend. Take a look at Canada. This did not update today. COVID-19 is moderate, flu A is low, flu B is low, RSV is low, and a reminder that British Columbia for wastewater at this time is high. This may update tomorrow. We may get other stuff from around the world tomorrow because really tomorrow is only a holiday here in the United States. All right, moving on. Let's take a look at what's going on with air qualities today. And you're going to see there are some bad areas for air quality. There's some big storms in the northeastern states right now. A severe thunderstorm outbreak that's actually, I think, wind-wise has overperformed what was expected today. Even some wind damage. But take a look at this. With that instability and whatever's going on in the atmosphere, there are some bad air qualities. And again, I'm watching what's coming out of Canada. I'm concerned we may go back to wildfire smoke again. We also see in the southeast some yellows at this time. Also, some concerning levels in California as well. All right, taking a look at what's going on with pollen levels and breathing quality index. Have to refresh both of these. Not good around the mid-Atlantic. We'll say Pennsylvania, New Jersey on southwest. Right on down to New Orleans, you're having bad breathing qualities today. That's not good. And I noticed I was outside a little bit earlier. I noticed it was not necessarily easy for me to breathe outside today, so that can be concerning. On Thursdays, grass pollen, you can see it is pretty much in the moderate to, we'll say, high. We're not seeing very high show up on this map today. That is fantastic news. All right, taking a look at what's going on with the EMS situation. We do see Pinellas County, Florida, multiple sick person calls right now. 1, 2, 3, 4, 5, 6 of them. And we do know COVID is high right now in Florida. Could also be heat-related illnesses and some other things, but we already know that COVID's high there. I don't like seeing this. Philadelphia, 887 EMS calls on Wednesday. It was slightly less humid yesterday, so yeah, this is just not good. And today is humid. It's 91 degrees here. The dew point is in the mid-60s. Yeah, it's still humid here today. Taking a look at what is going on right now in Montgomery County, Pennsylvania. Wow, we're late with today's video. This is really busy for 5:40 p.m. I am seeing several different things here. Cardiac arrest in Upper Dublin Township, cardiac emergency. We're seeing strokes. We're seeing fever. Fever's not good. We got to start thinking maybe COVID because, you know, COVID does cause fevers. And take a look at Chester County, Pennsylvania. Wow. Cardiac arrest in Wetz Township, or Wettstown Township. We're also seeing another cardiac arrest. We're also seeing stroke. Several different things going on there. That's not good. Emotional disorder is never good. And taking a look at what's going on in Bucks County, Pennsylvania, because we can now do that. The only difference is I have to constantly refresh this one. It doesn't automatically refresh itself. And we do see here a few things going on. Still trying to understand their types. Here's something I don't see in the other dashboards. A marine rescue. Respiratory distress. That's the thing there. All right, moving on. The hospital situation. It's not terrible in Pennsylvania, but it's not perfect either. We're going into a major holiday, and yeah, we can see here, Northeast Pennsylvania, I'm concerned about this. There's a lot of hospitals in the yellow up there. And that area is just getting flooded with people coming up for 4th of July. Going to the Pocono Mountains is a big deal in Pennsylvania. People do go to other parts of Pennsylvania as well, but the most popular for Pennsylvania on 4th of July, I would probably say, is the Pocono Mountains. And then another big deal, let's go over to the other states that we look at for a hospital situation. That's New Jersey. And we can see New Jersey is not doing terrible. Inspire Medical Center, Elmer and Mannington, both having surgical diverts at this time. And the hospitals I'm most concerned about there will be the ones along, quote, the New Jersey shore. That may be a problem this weekend. All right, taking a look at New York State for today, 387 people tested positive, which is lower than last week. And remember, today is New York City Day. So that is some good news. I suspect post 4th of July, we may start to see New York State going up next week. Taking a look at hospitalizations, 238 in the ICU, 29 at this time. And remember, the hospitalizations went up a little bit post Memorial Day weekend, and I think travel for this holiday is bigger than Memorial Day weekend. All right, taking a look at what's going on with emergency department visits, and we can see here in the United States two things. One, it's starting to go up. Two, they actually had to correct it a little bit higher, which is not a good thing whatsoever. It indicates things actually are starting to rise in the United States. And when we get the wastewater update and whatever else we'll update on Monday, we could potentially see the same thing. All right, Ohio, good news across the board. COVID-19 down this week for hospitalizations, 58. Flu down, 14. RSV down, 4. We'll have to see if that starts changing post 4th of July as well. All right, let's finish today on just a few wastewater sites. I'm going to switch this to the nationwide level. We can see things are still listed high in the south. Let's take a look at the chart for the south. We can now see multiple updates have gone upward. A little bit of a downward trend at the end, but overall, the south has been rising now since the better part of early June. And taking a look, you can see Hartford, Pennsylvania, now listed high for COVID. We looked at that a little bit ago. Let's go up here to, I believe this is in Kansas, and we'll see what's going on. This is Kansas City area now. A smaller wastewater site. COVID's listed high. I'm honestly not sure why. Yeah, it's rising, but why that's listed high. It says upward trend in the last 21 days and a medium concentration. So that says medium. This says high. Make it make sense. All right. Few things. Actually, no. Let's do one more wastewater site. Let's go somewhere out on the West Coast. Okay, let's check out Las Vegas. Is that a popular spot for 4th of July? I don't know. Is it? We can see here. COVID is listed at medium at this time. Everything else is fine. We'll look at some more wastewater sites tomorrow. I stopped my research for news a little early today, so if anything came out, we'll say after 2 o'clock this afternoon, I haven't found it yet, so that'll be in tomorrow's update. We'll have some numbers from CJS tomorrow. But before I leave you, we got to do a couple things. First off, we need a hydration break. Let's pause and have a sip of water. And I need to remind you of something. If you have tested positive for COVID, please, you have to skip celebrating 4th of July. You could stay at home. You could watch fireworks on TV. PBS will do something. I think, is it CBS that does New York City, or the Boston Pops will be on one of the channels. There'll be a whole bunch of different things. Yeah, I'm sorry. You have to skip the barbecues, all that stuff. Hey, you can watch the hot dog contest on ESPN if you have that, and maybe some other things. But, yeah, if you're positive for COVID, please isolate yourself. Do not go to a barbecue or whatever. In fact, I know so many people are having barbecues. We're having just a very small gathering in our yard tomorrow. People that actually, yeah, some of them actually still do isolate or just hardly ever go anywhere. Yeah, please do things safely, as safely as you can. We will have another update again tomorrow. Yes, there will be a holiday update. I'll probably do one of those scheduled releases. I think that's how I'm going to do it tomorrow. I'm going to record early and then maybe release it sometime early in the afternoon. I will see everyone again tomorrow. But until I see you again tomorrow, first off, if you're new, subscribe down below. Give this a thumbs up. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. Ways to support the channel are listed down below. And of course, stay safe. Have a very happy 4th of July. Take care. Thanks for watching. Enjoy your Thursday evening. See you tomorrow.